solution to real problems such as a person who decides not to buy health insurance because that's his or her right, gets sick, shows up to a hospital. That's question one. Question two, the example of the woman who was unemployed, starts her business and barely paid her bills, just cannot afford health insurance. He or she gets sick and goes to the hospital. What's the solution?
If I got rid of Obamacare, in your world and my world, what happens to folks like that? Unemployed folks who are in between jobs, what happens?
Long before Obamacare, we had a program we developed called Medicaid. I don't know where you are, sir. There you are. Medicaid is the biggest line on the budget, on every state's budget. We have a $24.7 trillion deficit in Medicaid alone, $25 trillion in Medicare alone. So there are programs we have already established for people who are poor, people who cannot afford to pay for their medical bills. Before we established our Medicaid program, 30 years after, I should say, we passed a law that says if you're within 500 feet of an emergency room, the government has to pay for your emergency care. Now, Illinois, since we're in Illinois is sneaking faster now than California because there were 11 Republicans and there were 4 lame duck senators right here in Illinois who decided they wouldn't wait for the U.S. Supreme Court's decision on Obamacare and decided to implement it here first, 6 weeks before the decision. What does that mean? That means that every year we have been rolling over debt from the prior year right here in Illinois. The total Medicaid, not pension, Medicaid debt is $23 billion that we have not paid. The reason that happened is because our former governor, Rod Blagojevich, who's now making license plates for us, he expanded Medicaid to far more than just the children of the poor, which is what Medicaid was designed for. So in Illinois, for many years, your health care will be paid for by the few, the proud, the 53%. What we have done now, when I say 53%, I mean 53% of this nation pays income tax, 47% pay none. We have now taken what Blago did here in Illinois, quickly, and we have expanded it all over the country. So the poor will not have to worry about fines for non-compliance for not buying health insurance because we will be caring for all of them, and we have no money to do that.
Let me stop.